All right, guys, we're back. We're going to finish up the urology and nephrology, and we're going to kind of dive a little bit deeper into the dialysis thing. And so I didn't want to go too far on that last video. So here we go with the third part here. And when we're dealing with dialysis patients, remember, dialysis is the artificial removal of the waste products and fluids and electrolytes from the system. It's done via either a mechanical or gravitational process. And hemodialysis is where we actually filter the blood. And then they do a peritoneal dialysis, which I think is the cool thing about the peritoneal dialysis is this can usually be done at home. The hemodialysis has to be done at a center. It has to be on a regular schedule, has to be done within a certain amount of time. The peritoneal dialysis, again, done usually at the house, okay? And in dialysis, the blood flows past the semipermeable membrane and it cleans it. And so the effect is usually temporarily lessens or eliminates volume overload, okay? So in hemodialysis, it's passed through a machine where it's actually the fluid and poisons are taken off of there. And then in healthy artery or veins are not available, the surgeon will usually graft a shunt into that area, okay? So again, most of the time they'll actually do this with the regular veins, but usually they do place a shunt or some sort of indwelling catheter, and usually these are Hickman's caths. There's some sort of central catheter, usually subclavian, sometimes an internal jugular, depending on how bad it is. And then what's the problem with this, though, is that you get you get bleeding from the puncture sites, and you get closing of those internal fistulas, okay? Now, again, the chronic ambulatory peritoneal dialysis, this is where there's they inserted into a semipermeable membrane, the dialysis, and that diastolate solution is introduced and then removed from the abdomen via an indwelling catheter, okay? So the biggest thing with this is, guys, is that you get infection inside the abdominal cavity, okay? Extremely painful, and it's a very common complication because, again, bugs get in there, or the bacteria, viruses can get in there, usually bacteria, and they usually start to spread, okay? So usually the complication, by the way, of doing dialysis is chest pain, shortness of breath, neurologic abnormalities. They can get a headache, seizure, coma. This is kind of a common thing. The other thing is that they draw the electrolytes off too quick. It actually can send them into cardiac arrest. And it's usually due to low blood calcium. Gang, if you go to a dialysis center, they're in cardiac arrest. Epinephrine obviously is your first drug. Somewhere very close to that, the second drug you should be thinking truly is calcium chloride or calcium gluconate, okay? And the reason that I say that is, again, because you really do need to get their calcium level up. If they've got their calcium level there on the machine, hello, they've got a machine that can monitor that. Yeah, get their calcium level. If their calcium level's low, start pushing, okay? Hopefully they've done it before you got there. All right, so again, acute or dialysis patients that are being dialyzed or just got off dialysis and they are in cardiac arrest, be thinking low calcium, okay? Now, kidney stones. These guys, again, we've had several patients, we get these all the time, and it's a brief hospitalization, usually because of the pain, but it usually can either block up a ureter or again, it causes problems with that. So this would be an example where, again, you got a kidney stone in the ureter. Ow. That looks like it's going to hurt. And again, usually they can use lithotripsy with the shockwave treatments, which breaks up the larger stones, and then they just pee them out. Okay. They can also go up through the urethra and actually grab the stone and bring it out. Okay. They've also used the laser up there. They'll actually insert the laser, send it up through the urethra, find the stone, zap the stone, it breaks apart, they irrigate it, they flush it out, boom, everything's good. But usually if you've got one stone up there, you've usually got a whole lot more stones up there, okay? So, but if, again, by the way, anesthetics, opiates, and psychotropic drugs, by the way, increase the risk for stones. So, yeah, so we're going to be giving them that, and it usually causes more problems.
Kidney stones, also called nephroliths, are deposits of mineral salts, called calculi, in the kidney. These stones can pass into the ureter, irritate kidney tissue, and block urine flow. Kidney stones are one of the most common and painful disorders of the urinary tract. Approximately 10% of people in the United States will have a kidney stone at some point in their lives. A person with a family history of kidney stones may be more likely to develop stones. Most frequently, the cause of kidney stones is hypercalciuria, where calcium is absorbed from food in excess and is lost into the urine. Urinary tract infections, kidney disorders, and metabolic disorders such as hyperparathyroidism are also linked to stone formation. Most kidney stones pass out of the body without any intervention by a physician. Stones that cause lasting symptoms or other complications may be treated by various techniques, most of which do not involve major surgery. People with a history of kidney stones should drink enough fluid to produce at least 2 quarts of urine daily. People prone to forming calcium oxalate stones may need to cut back on food and drink that contain oxalate, such as cola, coffee, tea, chocolate, spinach, strawberries, and beets.
All the good stuff. Okay. So again, especially I will tell you that the tea drinking, I will tell you that actually forms the oxalates in the form stones. So they'll tell you to hold off on that. We talked about that. We talked about that. We talked about this. So far, so good. So again, the key signs to the kidney stone is, again, visceral pain in one flank, usually 30 to 60 minutes, extreme sharp pain. And again, especially the good news is once it kind of gets down the ureter, usually once it gets into the bladder, it can pass its way through. The stones can get lodged in the urethra, though, just as walking can sometimes help reduce the pain. And again, abdominal examination may be difficult or hardly impossible. This is the one that we usually go with, positioned in the center of comfort. Be prepared for vomiting, though, because guys, they love to vomit. The kidney stone guys, if you've got one that's stuck, yeah, you're going to be starting to throw up left and right. Dilaudid, morphine, fentanyl are all wonderful drugs for these guys. And again, the IV, you can give IV fluid so it can help produce more urine, in which case that will help start to move and flush the stone. Priapism, again, is a painful or prolonged erection of the penis. Contrary to your popular belief, gentlemen, an erection lasting more than 30 minutes is probably not a good thing, okay? A common cause is usually due to sickle cell disease, by the way. So if you got a sickle cell patient it actually forms a blockage. And any blood clot for that matter can do this. I remember transporting a patient to Shands one time who had he had an erection for 4 days. And he's like, yeah, the first 30 minutes, this was great. He says after that, it started to hurt. And the funniest part was the nurse was like, well, he's got to have genital massage every 30 minutes. And I went, that's not happening. But again, his wife was riding along, so we made a little makeshift tent, and she took care of all that for me, and God bless her soul. But the long and the short of it is they are very painful. Tumors can cause it. Black widow spider bites can actually cause it. Yes, the little boogers get up there and bite those, and then again, associated with the numerous drugs, by the way. Matter of fact, they make drugs nowadays to help promote that. So again, it is a medical emergency. If you've got one that's lasting for more than 30 minutes, that is very unusual. If it's more than 4 hours, it's absolutely, we got a problem. Usually they'll go in there and they can go in vascularly and actually break up a clot if they need to, if that's what the problem is. Sometimes they can actually go in and drain. Yes, they can drain it. They go into the tubules and drain off the blood. That's a little bit on the tricky side as far as for a urological emergency. For us, we're not going to do that. Do not stick a needle in anybody's wiener. Any questions? All right. So a testicular torsion, again, this is the spermatic cords. It cuts off the blood supply. Severe testicular pain with that, and more common during the infancy and the beginning of adolescence. That's usually when they happen. But the other thing is as we all know, firemen like to show their affection by the groin punch. So trauma to those areas. Ladies, by the way, yes, you can cause a testicular torsion when you smack that area, okay? So be careful and be aware of that. Again, sudden onset of severe testicular pain. It's usually extremely tender and swollen and often high in the scrotum, by the way, usually. And nausea, vomiting, yes, they're going to throw up, they're going to get dizzy. And usually you identify it, and pain control is for that. Real quick, back to the priapism, this one here was one other thing. Those tubules, remember I said they could go in and drain them? Guys, those will also fracture. I know of several patients that have had fractures of this, usually due to rough interpersonal relations, okay? But yes, you can actually break those tubules, and there is severe bleeding with that. The one case I definitely know of for sure, I got into the room and it looked like a damn trauma scene. It looked like a blood. I mean, there was blood everywhere, and this guy was just losing it everywhere. Ironically, he was one of our officers, and I happened to be the poor sap that he wouldn't call for the ambulance, and so we had to load him up in his own personal car because he wasn't going to let me take him to the hospital, and that was a nightmare, but I'm going to tell you, he lost a lot of blood, but that is true. That is a true emergency as well, because the problem is the body continues to try to replace the blood in that area. So yes, they can actually bleed out doing that. Urinary tract infections, again, extremely common. Usually it's a bacteria in the urethra. If you've got a person at a high risk, they've got a catheter. Again, that's an entry point for germs. And again, they get into the urethra, a perfect environment for the germs to continue to grow and spread. Okay, nice and warm, nice and moist. Yeah, they love that stuff. So again, they usually have again, bladder infections, urethra infections. It can actually infect the prostate, and then actually the upper urinary tract. That's where it actually gets into the kidney. And again, so the lower UTI is what's usually common. In the ladies, it's extremely common. A joint systematic infection of the urethra and the bladder. And usually your sexually active females are actually at a higher risk because, guys, again, despite our cleanliness, germs get in there. Okay. So prostatitis, again, is the inflammation of the prostate gland. Again, the problem is there, it will close off the urethra. And then if it gets up into the kidneys, and again, 10 times more common in women than men, and you can get an intrarenal abscess with this. Again, those things kill nephrons. That's the biggest thing I want to stress to that, okay? And then you get a community gram-negative electric bacilli, and then E. coli accounts for 80% of all infections. You dirty individuals, you, okay? And for those of you, go see where E. coli comes from, and you'll start doing the math, okay? Again, non-sociomal factors, again, is caused by inpatient settings. Again, this is usually related to catheterization, which is, by the way, if you go to the hospitals now, used to, they would catheterize you. Nowadays, they're using more of the condom cath. They're using more of the, they use a little suction catheter for the females. It's a beautiful, wonderful thing because, again, it does not introduce the germs into the urethral tract, okay? And then you got your sexually transmitted, the chlamydia, the clap, gonorrhea, the drip. Okay. So again, for female urinary catheterization, we do not do these as paramedic. And again, but again, just so you guys, I'm thinking you've all seen this before, as far as, again, you have to spread it. We don't go for that hole. This is the urethral hole up here. Okay. This is the poo-poo hole. All right. Any questions? All right. Now, urinary tract infection. Again, focus on the painful urination. Usually they need to have a strong foul smell. Precipitate perhaps might be in the urine. The pain actually can be referred up into the neck and the shoulders. Okay. So again, the skin tends to be pale, cool, and moist, typical sepsis signs. And by the way, urosepsis is the number one reason that patients end up going systemically sepsis. Lloyd sign, this is tenderness to percussion of the lower back at the costovertebral angles. So usually if you're tapping on the sides of the spine and they're hurting, Lloyd sign, again, more than likely kidney infection. All right, ABCs, again, make sure that they don't aspirate. Make sure that they're give them an antiemetic. Analgesics are wonderful. You can consider them. And then hydration. That's usually the best thing that you can do. Start producing more urine. It starts flushing that stuff out. Okay. A home remedy, by the way, the cranberry juice, things with cranberry, cran apple, stuff of that nature. They'll hear you say that, and actually, what it helps do is it produces more urine, and therefore it helps flush out the kidney. Okay, so very important that they do that. All right, there's a lot of things again going on with the urinary system. Again, the biggest ones are the system stops working, which causes all the other bad side effects with the electrolytes and fluid balances. The other ones are the pain to the actual structures, infection in the actual structures. Those are our two big ones, okay? Remember, by the way, that it plays a role in arterial blood pressure. It does produce red blood cells in the kidneys, so when they shut down, it causes a relative anemia, okay? And those are the big things. Last but not least, again, cardiac arrest, and they're on a dialysis machine. You really want to find out how long they've been dialyzed, and I can guarantee you it's probably either due to they haven't taken enough off yet, or they took too much off, and you got to really quickly figure that out. But if they're on a dialysis machine and they've been on it for a while, more than likely it's going to be low calcium. Start giving them calcium chloride. All right, guys, I'll talk to you guys on the next one. Take care.